Summer reading, huh? What is? Oh, are we ready, guys? Here we go. I'd like to call the meeting, City Council meeting, June 6, 2024, 501 Main Street, Keokuk, 5:30 p.m. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. May I have a roll call?
Crenshaw,
Here.
Walker,
Here.
Garcia,
Here.
Cackley,
Here.
Dade,
Here.
Andrews,
Here.
Tillman,
Here.
Bryant,
Here.
Greenwald,
Here.
all present.
Item number 4 is Mayor Correspondence. Saturday, June 8th, 2024 is Farmers Market, 8 to 11:30 a.m. at the River City Mall. Item 2 is the Blue Tie Affair Band will be performing at the Rand Park Pavilion at 7 p.m. Friday, June 14th, 2024 is Flags Across the Mississippi, and it starts at 5:30 p.m. and you meet down where you start to walk across the new bridge. And then Monday, June 17th through June 23rd in 2024 is the Juneteenth celebration starts. So watch your local newspaper and Facebook. Tune into the radio for all the activities. They are doing a lot of stuff through the entire week. This has been a very busy week. We've had a group from Sylvester Broom Empowerment Village in town working in conjunction with the YMCA for some programs with area kids. They did an absolutely great job and the kids had a blast. Inside is here to give an update on the Rural Emergency Hospital. Public Works is going to give a report on the progress of South 18th. Our mural committee met with an artist from Iowa City in preparation for the new mural that will be on our Main Street. There has been some private donations to have that put on a wall here in Keokuk, and plans are in the making. The city received $4.4 million in a brownfield grant for the LCAM property cleanup. Main Street Keokuk received an email letting them know that they will be getting monies for a grant for new branding. So as always, eat, drink, and shop local. Stay positive. There are great things happening in Keokuk. Item number 5 is citizens' request. If we have anybody that would like to come to the podium and have something to talk about, please come forward. Speak loudly into the microphone. Give your name and your address. Anybody? Item number 6, consent agenda. Minutes of the regular city council meeting and workshop of May 16th, 2024. Minutes of the special council meeting of May 20th, 2024. Minutes of the safety committee meeting of May 23rd, 2024. Minutes of the Civil Service Commission for May 25th and 29th, 2024. Certificate list of candidates for the Keokuk Police Department. Resolution approving a liquor license for Casey's General Store, number 2595, 326 Main Street, Class E retail alcohol license, effective July 1st, 2024. Resolution approving a liquor license for Casey's General Store, 2636, 3530 Main Street, Class E retail alcohol license, effective July 1st, 2024. Resolution approving a liquor license for Dr. Getwell's 5-day license, effective June 21st through the 25th, 2024, for special event permit for Main Street Keokuk Summer Fun and Fundraiser being held on Saturday, June 22nd, 2024, from 6:30 to 10 o'clock p.m. at 501 Main Street. Appointment of Erica Barrett to the Historical Preservation Commission, fulfilling the term to expire September 1st, 2025. Appointment of Erica Barrett to the Board of Adjustment, term to expire April 1st, 2029. Appointment of Shirley Laubersheimer to the Civil Service Commission, term to expire April 1st, 2030. Appointment of Chris Carroll to the Building and Housing Advisory Board, term to expire September 19th, 2027. Appointment of Carlos Guzman to the Architectural Design Review Commission, term to expire June 19th, 2026. Appointment of Brent Meredith III to the Architectural Design Review Commission, term to expire June 19th, 2026. Reappointment of Josh Kirschner and Brent Reedon to the Revolving Loan Fund Committee, terms to expire June 1st, 2027. Resignation of Kyle Myers from the Historic Preservation Commission, effective immediately. Cigarette tobacco license for July 1st, 2024 through June 30th, 2025. Sidewalk display permit for Hometown Wine and Spirits, 1501 Main Street. Special event permit for the Keokuk Chamber of Commerce Farmers Market every Saturday through September 28th, 2024, 7 a.m. to 12 p.m. at Victory Park under the bridge. Motion to pay the bills and transfers listed in the registrar's number 5407 through 5409. Do I have a motion to approve the consent agenda? Motion to approve the agenda, including the consent agenda.
So move.
Any discussion? All those in favor say aye.
Aye.
All opposed? Item number 7. Consider resolution awarding contract for engineering services to Shoemaker and Holland for Grand Avenue from North 17th to Boulevard Mill and Fill project. Do I have a motion to approve?
So moved.
Public Works Department requested proposals for qualifications for design, engineering, and bidding for assistance for Grand Avenue from North 17th to Boulevard Road Mill and Fill project for 2024. The project consists of milling and filling engineer recommended amount of asphalt pavement, replacement of curbs where needed, addition of ADA pedestrian ramps where needed, and any other design features for said project. The project will be designed to the current SUDAS specifications. 2 RFQs, requests for qualifications, were received, and Shoemaker and Holland Professional Engineers was selected to perform the required engineering service. Any more discussion?
I
All
have
those
a
in favor say
question.
aye. What?
I have a question.
Okay.
It's centered around the reason that we are doing this particular street. Is this a part of the recommendation from the company that came to town, drove the streets, took videos, and declared that this was of the most important to be the first street to be repaired?
That was part of the reason. The other reason is we have staff sit down and go through those recommendations plus our own recommendations and the traffic counts on those streets. This plan was presented to council, I think, back in March, April, for approval. There was a list of streets, including this one, 4th Street, Palin, Tymia, that we are going to do mill and fill projects between now and 2026 using the $5 million that we bonded. Actually, 4th Street was going to be the first street that we were going to work on, but it has now been included in a grant that we're looking to receive or hear back on here in the next couple of months that would cover the cost of that. So then we moved over to Grand Avenue, which is why this is the first one on our list.
Okay, I know you did some repair on West Avenue.
Yes.
And 4th Street was supposed to be done at that time, if I recall.
4th Street was supposed to be part of this engineering package, but we had, in order to be included in the grant, we had to pull it out. We can't do any engineering prior to being awarded the grant. Otherwise,
Okay.
we'd be disqualified.
Okay, could I request a copy of the report from that company that came and did the survey and their recommendations?
You can come in and look at it. It's not really it's a computer program. So there's mapping that goes along with it. I can print the map out for you, and it's color coded with recommendations. And then another map is color coded that shows from 0 to 20, 20 being the best streets, 0 being the worst streets. I believe Grand is a 4 on that list. 4th Street was a 4 on that list. And then, so that's kind of how we're basing these. We wanted to do more than one project in this current year. 18th Street is on the south side of town, and it made more sense to do one on the north as to not to congest the south side more with more contractors.
You won't have a dollar amount yet
Not,
until the engineers just do their assessment on what the cost of the project would be
we
for
have
that many blocks.
we have a rough estimate, but not an exact, because they haven't been allowed to work on it yet. We have a rough estimate that staff put together for the project.
Okay,
What is that rough
I'll work
estimate?
it out with you to get that information.
Okay. If I recall, it was around 280,000-ish to do this portion.
So the entire mill and fill and everything from 17th over to Boulevard would be in the
Roughly, I
200?
mean, and like I said, that was us putting, the only thing that the city staff left out was ADA compliant ramps. Those are a little harder to estimate. Those will add some cost to that.
Well, I'm kind of the opinion after reading this proposal that whatever's left over from the bonded money after we do 18th Street could be better served, spread out more, and maybe focused on streets that are just the highly trafficked in the worst condition. You know,
Yeah.
not to say Grand isn't in bad shape. I know it is, but maybe we could stretch our dollar more. Because I think when we factor in that costs of everything are going up, that 5 million, you know, by the time it's used is going to be less than it was worth when we bonded it.
Correct.
When we talked to the people who came, they said that we shouldn't do the 0 roads because while you're fixing the 0 roads, those 4 to 10 roads then become 0. So it will cost less to fix those roads in that middle, not great, than to fix the 0s and then lose many other streets in that process.
And like I said, the streets that we are currently on the list and that we're working on was, you know, we had the Public Works Committee meeting and got their approval and then brought it to council and got your guys' approval for that list. And that's what we're working off of right now.
So the engineering, the mill and fill, the engineer is because of the ADA, is that?
With the engineer requirement is because of a dollar threshold that we have to do by the state of Iowa. So if your horizontal infrastructure projects are over a certain dollar amount, they are required to have an engineer.
And like West Avenue fell under that.
West Avenue fell under that, yeah.
Okay.
I believe, so the city's dollar amount is $100,000. The state's dollar amount, I think 136. Yeah. So anything above that, per our own ordinance, anything above $100,000, we have to solicit for engineers. And then it has to go out to a public bid letting.
I have a concern about spending too much of that 5 million before we're into in more completion of the 18th Street project, because what happens if you spent a certain amount down close to, what is that, 3.4, whatever,
Yeah.
that 18th Street is expected. If you're planning on spending 1.6 million, I'd like to put a cautionary phrase in there because oftentimes projects come in over expected expenses.
They
And you
can,
don't want to be caught in the end struggling for funds to take care of a project that was already supposedly paid for.
right.
Okay, thank you.
Also on 18th, there is $960,000 that comes off the top of that we will also get to use in addition to the 5 million. Yeah, we received a grant for 18th Street. It is, so it's for we still pay for the engineering out of that $5 million. So that grant, when we submitted, is for all of the engineering fees. I believe we're at $450,000 worth of paving. Is that correct, Dave, when we resubmitted? So it's broken out in different line items. There's the engineering line item, the historical evaluation, the environmental, and then concrete and construction management. So that's what that grant will reimburse for the city, which is a total of $960,000.
Any more discussion? All those in favor say aye.
Aye.
All opposed?
No.
Item number 8, consider resolution for placement of the flower garden sculpture. Do I have a motion to approve?
Second.
Crystal McGee, representing the Keokuk Garden Club, attended a Park and Recreation Advisory Board meeting to request permission to place a sculpture at the Rand Park Flower Garden. The Park Board agreed the sculpture would make a nice addition to the flower garden area and recommends approval. Park and Recreation Advisory Board recommends approval of the sculpture to be donated by the Keokuk Garden Club in Rand Park Flower Gardens. Any discussion? All those in favor say aye.
Aye.
All opposed? Motion passes. Item number 9, consider resolution approving a contract for transportation services with Southeast Iowa Regional Planning Commission. Annual contract with Southeast Iowa Regional Planning Commission for transportation services 7/1/2024 through 6/30/2025. No changes from last year. Staff recommends approval. Do we have any discussion? All those in favor say aye.
Aye.
All opposed? Motion passes. Item number 10, consider resolution setting a public hearing for amendment to Title 20 zoning side yard setback for F2 condominium district. Do I have a motion to approve?
So moved.
Carl and Barbara Pinella and John and Jan Filkins have requested to amend the side yard setback requirements for F2 condominium district. This will allow property with a condominium to be split. A public hearing must be set for all the zoning amendments. The City Planning Commission met May 20th and recommended the side yard as requested. Public hearing was set for June 20th, 2024. Do we have any more discussion? All those in favor say aye.
Aye.
All opposed? Motion passes. Item number 11, consider resolution approving final plat of survey for Property Partners LLC. Do I have a motion to approve?
Second.
Pivotal Housing Partners submitted a plat of survey for the division and for the subdivision and or reconfiguration of boundary lines on property adjacent to Lincoln Avenue situated north of Johnson Street Road. There are existing parcels that they wish to configure to allow construction of an apartment building. Pivotal Housing Partners will be purchasing a 5-acre parcel from Property Partners LLC once the plat of survey has been completed. The City Planning Commission met on January 22nd, 2024 to review the preliminary plat of survey and recommended approval. The City Council reviewed and approved the preliminary plat on February 1, 2024. The city auditor assigned parcel letters, and the final plat needs to be approved by the city council prior to the meeting. Staff recommends the final approval.
Kathy, Mayor. Mr. Willis Mann is here this evening. If anyone has questions regarding the project or the subdivision.
Is there any more discussion?
Is this low-income housing? I can't remember. Okay.
Sir, could you come to the podium here so that we can hear you better? Acoustics
I
here.
probably need to be sworn in too, usually.
No, you're fine.
Okay. Yes, it is.
Is it just low income or low to moderate?
Low to moderate. So we're using income averaging, where the average income of all the residents will be 60% of AMI, but it stretches from 40 to 80%.
This affects me because I just live across the street.
What are the sizes of the apartments?
They're 1, 2, and 3 bedrooms. I don't have the square footages of. Okay.
Any more discussion? All those in favor say aye.
Aye.
All opposed? Motion passes. Thank you very much, sir. Item number 12, consider resolution waiving permit fees for the Keokuk Homeless Alliance. Do I have a motion to approve?
So moved.
Keokuk Homeless Alliance are requesting the building permit fees be waived for renovations for a homeless shelter at 601 Johnson Street. The approximate permit fee cost is $770. Staff recommends approval. Do we have any discussion?
Why is staff recommending approval?
Pardon me?
Why is staff recommending approval?
So council has generally waived fees for nonprofits. So that's the reason they're requesting this. So I think it's something that the community probably needs. They're doing a lot of fundraising to try to do the project correctly, and I think that'll just assist them.
I'm not opposed to this at all. I agree with this because bottom line is all they're asking is just the fees. They're not wanting us to change codes. And that's the thing, as long as they don't expect us to, relax a code or let them get past one code, this is minor. I think I saw they're looking at potentially close to $100,000 to get the building up to code. And I noticed they put that in there. We need to bring it up to code. So for us to give them $770, I'm good with that.
Yeah, because they're changing use of the building, they're required to sprinkle at least the residential part of it. So it's quite a cost to them to actually, they could have went into a residential district into a house and not change the actual zoning or use of the structure, and they wouldn't have had to sprinkle it.
Right.
So that's quite a cost that they're going to, have to bring the building up to code per City Keokuk's regulations.
Would we be waiving this permit fee, or does it include like permit fees in the future? Is it just this one?
Just this one.
Okay.
Yeah, and that's actually will be for pretty much the entire building. There will be like a $50 fee for the sprinkler system, that they will pay, but this particular building permit fee is the only one they have requested.
Okay.
Any more discussion? All those in favor say aye.
Aye.
All opposed? Motion passes. Item number 13, consider resolution granting Glencore an easement at Kendustry Park. Do I have a motion to approve?
Second.
Glencore has requested that the city of Keokuk add on to the existing utility easement located between Lot 1 and Lot 9 in Kendustry Park Division. The city owns Lot 1, and therefore the additional acreage would come out of Lot 1 and total 0.57 acres plus or minus. Glencore currently has a force main that pumps effluent from their lagoon location on Carbide Lane to the city's sanitary sewer system located at Kindustry Park. This force main is in need of repair, and part of it needs to be relocated out of the ravine that it is currently in. Erosion over the years has undermined the pipe and is no longer stable in its current location. Glenmore has Klingler and Associates as their engineer and are awaiting bids for the repair work. Granting the easement is a necessary step to making the repairs to the force location. Staff recommends approval. Do we have any discussion? All those in favor say aye.
Aye.
All opposed? Motion passes. Item number 14, consider resolution authorizing an agreement with Task Force Incorporated for the recruitment of a city administrator for the city of Keokuk. Do I have a motion to approve?
Moved.
Consider resolution allowing the mayor to sign to enter into an agreement with Task Force Incorporated, 1013 Main Street, Keokuk, Iowa, for the search for a city administrator. The cost not to exceed $4,000. Staff recommends approval. Do we have any discussion?
I am wondering what the Personnel Committee has changed as to requirements for this position, salary, what is different?
So if this gets approved tonight, Tricia started working on like an advertisement flyer, and we are going to update the requirements on there, and then we'll send it to you guys so that you can see what we've talked about changing.
I guess I kind of want to know that we've got a better plan in place before we recruit someone.
So, I guess a few things that we talked about changing was lowering the top part of the salary, and we're going to be making the requirements less strict on the experience and the years, for example, so to widen up the options a little bit.
My worry is that we're doing the same thing and expecting a different outcome. This is not against Trish or Task Force. I think there is no one better for the job than her. She is great for Keokuk. They are an excellent business, but locals did apply to the last one. So who are we expecting to apply now if we don't totally renovate what we're looking for?
I think that's a legitimate concern, but we have to reach out. We got to find another pool of candidates, find somebody that fits. It's too bad it's got to be a long process like this, and I don't think we like it any more than anybody else, but hopefully we can reach out there, and with Trish's services, we can find somebody who's right for Keokuk.
Did you want to put like something specific on there for like a trait that you're looking for specifically?
No, it's not about traits. I think that what we've received applicants for what we've asked for. And that's not what I think, maybe that's not what our actual vision is. We need to be very real and honest with ourselves about what we want and what we're willing to accept. And I think people are leaning more toward a local option, and we have had local applicants. So what are we expecting of them? What is the bare minimum that we are willing to take? What kind of on-the-job training are we willing to give? I just want to be able to give her actual resources and not her do the same search that we've already conducted.
One thing that we thought that we would not be going throughout the whole country. There will be a circumference of location to the city of Keokuk. I don't know how many miles that would be, but it will be closer instead of taking applications from everybody.
I mean, I think we're an equal opportunity employer. We have to accept them from anyone, probably.
Oh, yeah. All those who applied before are still more than welcome to apply, and will be given their due consideration, just previous process,
I'm just wondering, what is the outcome that we think is going to be different?
Hopefully the outcome is we hire a good candidate.
Do we think we're going to attract a whole different pool of candidates with a similar advertisement.
I don't know that we're going to have a similar advertisement. What we're asking tonight is that we enter into contract with her, and then she is going to present to the personnel committee where she can send out to, what she's going to do, and what she feels like should be on the application forms. And then after that, we can make a decision as to how we want to, what do we want to add and subtract? Do we want to keep the same salary? Do we want to keep the same exact requests for education or the same requests for experience? I think that the only thing we're asking tonight is to enter into contract with her, and then we have to come up with what we think after that.
I guess it just feels a little bit like cart in front of the horse. If we do this, I think that it should be done at a workshop and maybe not in a committee. So that we're not continually going back and forth. How do we get what everyone thinks is necessary on there?
Well, I think
Just
that's
an
what the
idea.
personnel committee is for rather than a workshop. But if the council thinks that we need a workshop, they can go from there. But we actually, again, all we're asking is to enter into contract with her. We don't have anything specific. We are supposed to find out if the council wants us to enter into contract with her, and then go from there as what the specifics would be.
I understand what we're doing. I just don't want to waste her time or mine. So that's why I'm just wondering the workshop. I understand what the personnel committee is here for. I think they've done a great job with what they've been given. But when we're talking about bringing in department heads, community people to help make this decision, a workshop would be a good place to get all of those ideas in one place. And then go to the personnel committee and you can narrow it down from there. Just an idea.
Did we talk in a council meeting about bringing the department heads and everything in on making the decision? I don't remember doing that. What I remember was given back to the personnel committee. But if the council chooses to have it in a workshop, that's fine. I guess we have to make the decision tonight whether we want to enter into contract with Trish.
Well, I definitely understand as far as use of time and resources on before we move forward with Trish, just based on how collectively everything came about with the different entities, as far as in not just the council, but the citizens and then the personnel. So I can definitely see the point of doing it as a workshop to collectively get all the information, but we did hand it over to personnel also. So I think both, I would be in agreement to do it as a workshop.
I think one of the good things is that a lot of the legwork is already done. We're not going to change the requirements too much. And the requirements with the previous consulting company was approved. I think everybody was on board with that. So there shouldn't be a whole lot of change putting it in Trish's hands. But I do expect a different outcome because we'll be reaching out to a different pool of candidates and maybe find somebody local who, genuinely cares about the community. That would be best case scenario, if somebody who's qualified that really cares about Keokuk. But eventually, I think, we're just going to have to fill the spot. And if we went through the same company that we just went through again, then I could see how we, could expect a similar outcome. You know what I mean?
I guess I'm just wondering what is the different pool, because this company that we had, they got local applications. So that's what I'm confused about. If we aren't changing the requirements, who is the different pool?
Well,
Where are we going?
We discussed that a little bit, without going into specifics, obviously, but part of that is all of the local candidates, because of what we chose as requirements on the last one, all of the local candidates were already not qualified, because what we told the consulting company, we want this, we want a minimum this, we want a minimum this. None of the local candidates met that.
So that's what I'm saying. You would have to make drastic
So
changes. It
we're,
wouldn't
but
be the
we,
same.
that's what we discussed. We're going to change some of that. We haven't decided for sure what all we're going to change, but that's why all of the local ones were already out, because none of them had some of the requirements that we as a personnel committee brought to the city council, and the council said, yes, this is what we want. So now we have to go back to the board and, okay, we're going to change that, but we don't know for sure what we're going to change that to yet. Trish is going to help us do that if we hire her. And this was brought up quite a bit in the personnel committee, that we had local and none of them met that qualification. So now we're going to it. We're going to lower some of those qualifications. We don't know exactly where that's at yet. Obviously, once we get it started, we won't do anything without full council approval, but to put it out before a workshop and throw everything out to where it's completely out in public, you're kind of already, you talk about hitting the cart before the horse. You're blasting out exactly what you want. This is what we want to do. This is what we want to go. Well, and then you can have, well, we could maybe pay up to this amount. So then somebody, he sees that, they're going to come in here and just, well, you said you could pay this, so this is what I want. And so keeping it a personnel committee, it keeps it a little more closed until we get some real specifics. And then we come to city council and then let's change this a little bit, but get all the hard work, or not the hard work, but the main grunt work. Let the personnel committee kind of bring some of that. We've all got cell phones. You can talk with any of us, hey, we want to change this. But this way we don't tie up all of us, all of the department heads for potentially 2 or 3 different workshops trying to figure it out.
No, I think the workshop is for transparency. You may not discuss salary, but you say, after that round and, we decided maybe we don't actually need such an emphasis on this part. Like, I can guarantee you that those citizens and the department heads would want to be a part of that conversation. They would not feel tied up. One workshop being able to say, hey, and then go to the personnel committee. You discuss iron out those details of salary, things like that. The difference is, what do we want to see in this person? Because we have had a pool, we have had multiple candidates apply, and they weren't a good fit. Why were they not a good fit? What would be a good fit?
So
That's all I'm
Rosalind,
saying.
question for you then. From what I'm hearing you talk about, would you want to make a motion to table this until that workshop took place? Or are you comfortable getting on contract with Trish and then having those discussions? I think that's the point we're at.
Oh, I'm comfortable doing a vote. I'm just going to share my opinion on what it is. That, I'm just one of 9.
It's been mentioned before, we had more workshops and that didn't go over very well.
So we do have a motion on the table. Do we want to proceed and vote on that, or do we want to make an amendment on it? What do we want to do, people? Any more discussion?
I think we should vote on it as it's presented, and then depending on how that goes, points us in the next direction.
Okay. Any more discussion? All those in favor say aye.
Aye.
All opposed?
No.
Motion passes. Item number 15, motion to approve. I need a motion to approve special event permit for Main Street Keokuk Summer Fun and Fundraiser Saturday, June 22nd, 2024, 6:30 to 10:30 p.m., North 5th Street between Main Street and the alley, alcohol being served, pending dram.
I have a procedural question here. I know typically special event permits are part of the consent agenda. So I was just wanting to know the reasoning for wanting to talk about these each individually tonight.
So our ordinances require council approval for alcohol on city-owned property, and item 15 they will be serving alcohol on city property. And the other 2 will have similar instances there.
And do the permits have all the standard requirements for the alcohol use?
Yes.
Thank you. So moved.
Any more discussion? All those in favor say aye.
Aye.
All opposed? Item number 16, Motion to approve special event permit for J&M Display, Doug Deck Service, Funeral Shell Firework, one funeral shell, Oakland Cemetery, Saturday, June 22nd, 2024, 8 to 11 a.m.
Second.
Any discussion?
So the reason this one's on the agenda for council approval is it went out to the department heads. While I don't think the department heads were necessarily opposed to it, it did draw some concern, but not enough concern under our municipal code to deny it. The reason then falls on the council to approve a funeral shell. It's a firework. It is one shell that is set off in Oakland Cemetery at the time of service. So anytime a firework is allowed on city property, that requires council approval. So that's why this one appears on the agenda also.
Is this for the fundraiser event?
No, this is for a funeral service.
Oh, okay, I'm sorry. I knew that there was like a 5K coming up, so I just assumed it was for that. I apologize.
Any more discussion? All those in favor say aye.
Aye.
All opposed? Motion passes. Item number 17, motion to approve a special event permit for Brent Matlick, Dr. Getwell's 1100 Block Side Street for the Juneteenth celebration Friday, June 21st, 2024, from 12 o'clock to 9 o'clock p.m., outside music and food.
Second.
Any more discussion? All those in favor say aye.
Aye.
All opposed? Motion passes. Item number 18, council liaison reports. Item number 19, staff reports.
We had the pre-construction meeting for South 18th Street today. Jones Construction is scheduled to start on June 17th. They will be starting on the Main Street end of the project. A groundbreaking ceremony will be scheduled in the near future, in the next couple of weeks. We will let council know when that date is set. We've also been working on a set of rules and regulations for our city campgrounds. Currently, we do not have any written rules on the books at City Hall. We are also proposing a price increase for our campgrounds. This will be included in the July 20th council packet for approval. We are in the process of having cameras installed at Victory Park and Tolmy Park. The Tolmy Park one will be specifically for the splash pad, bathroom area for vandals. Victory Park bathroom area and that area under the bridge we've been having quite a bit of trouble with. So here in the near future, there will be cameras on those sites to help us monitor that.
Anybody else? Item number 20. I'd like to we need a motion to enter into closed session pursuant of Iowa Code 21.51C to discuss strategy with the legal counsel concerning intimate litigation. Do I have a motion to enter into?
We have Pat O'Connell from Lynch, Dallas on the line. Pat, can you hear us?
I can hear you. There's a little bit of an echo, but.
Okay, so the mayor just read item 20 to go into closed session.
Okay, before that motion is made, I will opine for the record that the subject matter concerns legal advice to be sought from legal counsel, that is regarding imminent or existing litigation, and therefore it's my opinion that under 21.51C of the Iowa Code, we are lawful to go into closed session for that reason.
So moved.
Any discussion? All those in favor say, oh, no, I need a roll call, I'm sorry.
Crenshaw, Walker,
Aye.
Garcia, Cackley,
Aye.
Dade,
Aye.
Andrews.
Aye.
Tillman,
Aye.
Bryant,
Aye.
Greenwald,
Aye.
all ayes.
So for everybody out there, we will be going into closed session. We'll be back just as soon as we can.
So they're all over that, so that's taking in resources that they're going to the line. So we're trying to build those relationships. So now, the process of I told people that we're in the process. Their own ways mentioned some of the things you have to. It's not just a matter of cost, but it's a matter of time. Our work is something that takes more time. That's the time we have to work with. Yeah, we'll do that, you know, at the end of the day. It is a machine. Just take we start pressing here. Probably. Yes, yes, I think it was. So when we start talking here, I want to open up October and open up the REH by first year. The state was telling us this was fast, it's easy, you know, we have 90 days, we're only going to keep a month. I mean, but I think they have time to get into some larger organization in terms of personnel. I'm sure we felt like some of the more pressing matters. We kept thinking this was all going to be their team was getting information. Our team was saying, and it was one of those, we don't feel like we should come in. Right. I mean, I know you all are asking for that, but like I said, right. We're trying to push it. Kind of like, it's done. We thought there was going to be some regulations that were separate from the hospital. That's the indication. We're going to have to follow our regulations. We're going to take 6 months to write. Yeah. And 6 months later. And then. So you got this. Yeah. Yeah, it's kind of a conversation. Right. So we posed a couple questions. Don't. They set up a meeting and say, hey, we can't meet it. We don't know what we're talking about. Yeah. And it's the part of it is that's the ones that write the regs. Our motivation level is not changing. But we do also understand you can only ask so much. And the point, the typical. Very responsive and quick. I wonder, right? It's completely understand their role necessarily. She's supposed to facilitate this whole process. Area goal. So Kelsey has come up with this. And it works very well, very close. Her role, she's the which is our biggest mission entity. And so she ends up getting special projects that don't have a separate structure. You know, my role in this process has been facilitating a lot of subject matter expert in different areas. So, you know, so was basically assigned facility. And she had done a variety of things from inside. She was an construction person by law and trade. So the area is her ongoing subject matter expert that she turns to. So it does create kind of different way. Last summer, we were knowledgeable about the facility and say, you all have some decisions to make about this footprint. It's cut and dry. It's just saying, well, here's your obvious solution. Like, process, she's not opposed to it. I'm not saying it's what she has, but she's not planning. Right. It's probably, yes. But if we took it to a point where you're making some decisions now, truly you're push back out, truly making why is it so necessary that push back on this? Ellen's done a good job. Yeah, sure. Well, it's a bike space. So, begin with. But then when you have different types of spaces in their separations, that just makes it job look for all those different issues. And so we've been able to, we've been able to identify a space for the RDH thing. And actually, this is separate. It works out great. But I think what we're looking at is will be beneficial to the operation because you're not paying. So now you're getting the lab. It's a better solution. Big folks just ask them. The thing is certainly a problem. Yeah, that was interesting. Bigger, but none of them. It's gotta be, we have more people taken out. Yeah. So. Systems or combination. Asking them to look and see, right? That's the problem right now, so. Just make that more of a central space. Another issue is that it's really just maybe a little bit. Most of the stuff came out. Med gas. I know that's right. There's a bunch of that, but very little of it. Don't worry about HVAC. It's great. Don't worry about that. Don't worry about this. And so we kind of left that alone, thinking, well, okay, we're going to use everything we got. But we didn't really invest in the ship. Our team is not, our team is. We like to solve problems. So I think folks are just seeing it more in that way, you know, that closer explanation. We were more time. We were communicating with the state. He was always. We're gonna find some other things. He's trying to want something, right? That's that. So he was always. So far. Our team's gonna want access. I think they're gonna be. But maybe you guys look at that and say, hey, you can say, I don't know, maybe it's just I don't want to play, you know, it's gonna cost, you know, something on our side. We didn't know the tip of our we said now that's very challenging, you know, but we've said from day one, that's going to be part of the so, like, we're not in that system. Say, okay, now we see what you're saying. It's we're finding a way to ask for something. So that's also correct. you know, it was the little things around there. So that's how you all of that is basically pro bono. Right, even though it's a separate project, we're doing some very. That is nice. So we're committed to that. I was out so we're not asking for help. But we think there's no. We're not going to be shy. Hopefully they're doing some of that legwork for us. Looking for. So yeah, we're off. So you know, my learning curve is. Sneak on this, and you know, all of you. So. I wasn't. Hopefully she's heard. Some other folks. Those folks that buy overall, make sure we said, these are the things that we're looking for. We know what's going to help the state level, watch them know. So there have been surprises. Built one for a year, almost a year and a half in. Especially if you're 11 and 10. Pretty Stop by my house and live here. Well, I live in the house. So even a little closer. So I stopped. I live on the north side. Yeah. So I stopped at my house for a couple of stuff. We're almost done. So about 5 years ago or so. You could take that building and put it in the lobby of the other bank. Right. And everything would fit in there. So tired of that. But they had like a tower, make a tower, like 10 towers or so. And then when they were ready to close that thing, they had maybe 10 towers. One, right, or two. And now, when they offer the tower was drive-through, or back, same time, so they may have 3 people operating it everything. I know, so that industry's changed. It just. This is good. So. I resisted it for a long time. And this is a perfect way for something like that. Almost forcing you. It's not pretty good about that. I still like that interaction. And I have to get it. I have to get so that's what I think would be on that. I said, you'll do that. So really don't need to come in. Hour later, contactless. Yeah, she walked into our lobby with an envelope with the cash register. That's interesting. But now I understand it on their side. Provide service. Folks that look correct. The direction of the because I changed, so things change. Personally, or there was just something. Just based on what you come to. You didn't do it on your phone or come to a kiosk. That didn't happen. First time. And especially once you get into, I was part of the drive down Minneapolis, and there was no whole counter service option. It was all it's terrible. Every other time, I'm driving, like most of the trips, there's always been somewhere. That's crazy. Yeah, and it is. This was like on both sides interstate. Like it was. So yeah, they have all the time. Just think it was long and everything. Well, I think that they're going to be. I went to one already, but this place was still self-service. Yeah, they still have today. They're all. Yeah. They're right. They're wrong. You want to go wrong way? That was quite nice. Right here. Sitting there.
My brother was there.
What's your brother's name?
Chris Carroll.
Yeah. Chris Carroll. Yeah, he's doing well.
Good.
He's picked up a lot of work already.
Yeah, that's what it said.
He's been busy.
Yeah.
Yeah, that's good. Yeah, the community health center. It's almost done. Yeah. I like that area. It's close. Looks good. Yeah.
Probably the president.
No, I think I may have like 10 slides. I think it's gonna be more of a question of, and then folks will be ready to go on a longer meeting. I just got a couple of insight, a couple on the rural emergency hospital, people understand. Emergency department 24/7, and then I've got a timeline, one slide that shows kind of phase one, the whole phase one. We might have a phase 1A, phase 1B, or just show people, hey, this is the ground floor, this is the part of the hospital.
Good.
A matter of how much is one has. Right. Oscar, I was 6, I put them in at 6, I mean, it took them a few minutes to get seated, but 6:15. So they're over an hour. Democracy at work. It's slow.
What would I do? Some decisions are tougher than others.
Yeah. But sometimes you all are out here like a half hour, right? So.
Yeah, right.
Damn.
You.
Yeah, I think, shots, just, two shots in the background, but.
Which one of these hot topics are you gonna write about?
Yeah. And we met before. I'm Dan, you know, and so,
Here, you know it too well.
yeah.
You want to write that.
Still got that.
I saw about this street. All the streets that we wanted to do. One goes down. The rotor of streets. This side of Grand Avenue, when it comes to, and motorcycle with that, and that was a horrible street. So,
I'm just about that, but.
so the easiest way to explain it, I can put our map on the wall. Blindfold, they hit in the dark, throw it, and you're gonna hit the street.
So, it's not, we just don't take, we do take the advice of that. But then you have myself, street manager, administrator, collectively, all of that, hierarchy of streets. The bad thing about all the streets in town over the years was the building office. They just come in and over. You got this much curves. And we'll say we'll work with the building. You've got drainage, gravel. Then you're at this point. It's where 15, 28. They're all 2 inches on the ground, we spend 5 inches. Back down to where it was, so there's a work. I don't know, it's it says specifically in there, you can have a project. So we can do that. And I was gonna say, well, cut this in half, so you can- Sometimes you probably don't really need it. So that was what also answer anyway, it sure is. Expansions, what we want to
Other grant work that we had to get to even though we're here. So.
My mic's
Are we gonna take 5 minutes in between or?
I need 5 minutes. I don't, no, no, no. I don't care.
What'd she say? Take 3, how's that?
One more. Sweet or unsweet?
Sweet.
Sweet, you make your own.
This is not.
So do we have to? Okay. Are we ready, guys? I need a motion to return to regular session.
So move.
Second.
Any discussion? All those in favor say aye.
Aye.
All opposed?
You ready for a motion?
Yeah.
I'll make a motion for the city to engage the city administrator and the city attorney to take action and proceed forward as discussed in closed session.
I'll second.
Any discussion? All those in favor say aye.
Aye.
All opposed? Item number 22, new business. Item number 23, motion to adjourn. Do I have a motion?
So move.
Second.
All those in favor say aye.
Aye.
We'll take 3 minutes, guys, and come back. 3. Well, somebody didn't want to take any, and somebody wanted to take 5, so we're taking 3.
This is our official lease. This is the first one. And that's what it says. Somewhere. They may be there somewhere. Right. I looked. I know. And I was second guessing myself.
Boy, are you guys in trouble.
I get it. Okay. Inside.
Could do something. Okay, guys, shall we get started? Okay, I'd like to call to order the City Council Workshop, June 6, 2024. We have one presentation, and we're going to have Mr. Dane Walling come to the podium, and the presentation is on the hospital from Insight.
Good evening, everyone. Thanks for the opportunity to come, even though I know the hour's getting a bit late. We want to share with you the work that we're doing to reopen the Keokuk Area Hospital. My name is Dane Walling. I'm the Senior Policy Advisor and the Director of Public Policy and Government Relations for our Insight Health System. We're based in Michigan. We have operations now in Michigan, Illinois, some management work with the hospital system in New Jersey, and we're working on this and some other projects in communities around the country as we work to expand our impact and the services that we're able to provide. So I have a pretty brief PowerPoint presentation for you, or slide presentation. Wanted you to have some key points in who we are, what this new rural emergency hospital designation is that we're pursuing with the state of Iowa, tell you about the timeline, the work we're doing this summer. I have Dan Culp here as a resource, depending on the questions you may have. So Vice President with Carl A. Nelson and Company, and they're performing our design work this summer and had last year performed our preliminary assessment on the building, and that's a major part of our focus right now. So I think, City Administrator, you click the slides through for me. It's up for you. So again, this is what we'll cover, who we are as an organization, the kind of partnership that we want to have with the community, the fact that we provide high quality patient care second to none, what this nonprofit rural emergency hospital will provide, our opening timeline, and then any, stay for as long as the questions and discussions as you have for me. Please, if you have a question while I'm presenting, you're welcome to ask as we go as well. Insight is a physician-led organization. So our founder and CEO, who some of you have had the opportunity to meet, Dr. Jawad Shah, he's a practicing neurosurgeon, started his clinic in Flint, Michigan in 2008. That campus has now grown to over 300 employees, more than 24 specialties being provided at the Flint Medical Campus. And then our chief medical officer for the system, Dr. Rani Aburashid, is a neurologist. So we're very much kind of focused on providing patient care, and we do that through a combination in different places of for-profit and nonprofit entities. The Keokuk Area Hospital is being reopened as a nonprofit hospital, the way it's always been run through the decades. So our mission is patient care second to none. We're very oriented towards our core values, and from Our Chief Strategy Officer, Atif Bawahab, who some of you have also met, our Chief Legal Officer, and then our CEO. We've always felt a real strong kinship with this community. We look to provide service in places that we see as being underserved, places that really need medical care and services being made available to them. And we just felt like from our first visits to this community, going back to the winter of 2023, 'cause we didn't get involved until the hospital was already closed. Just a lot of shared values, really having a shared vision for what this hospital should be. So that's the foundation that we're working from. And this gives you a sense of how we've grown over the years. So we're a network of affiliated healthcare entities. We focus on local needs, but we look to bring kind of resources from across the nation into every facility. So part of what we've been doing this week, in addition to our Sylvester Broom Empowerment Village team, enriching and offering opportunities through the YMCA, we've had our national grant writing team that's half based in Michigan and half based in Illinois visiting the community for the first time and starting to think about, new partnerships, new grants that we could be pursuing. But we've grown over these kind of 14 years. You see the numbers there, 4,200 staff and physicians across the network. This is even bigger than some of the numbers we shared in previous visits. Over the last 3 months, we've been providing management services to a network in New Jersey, Hudson County, the CarePoint system. That accounts for 3,000 of those employees. They're a 1,100 bed hospital system. 2 of those are nonprofits. 1 is a for-profit entity. So we're working across all of those different locations. But in every place we go, we're really committed to working with the local community and making sure that we're really responding to community conditions and community needs. We're not a network that has a kind of cookie cutter approach. And we've been very proud in recent years. We've been recognized for the work that we're doing with providing patient care, being recognized as one of the highest rated patient hospitals, patient safety hospitals in Chicago. We have hospitals that are ranking very high in an index of social responsibility. And what that involves, if you look into the numbers, is hospitals that are really providing care for patients who are using Medicare and Medicaid, which we know would be a big part of the patient population we'd see here. So we're very prepared and very interested in serving patients that are using Medicare and Medicaid. So the building, this slide we use and as we tell people about this story in other places, but this hospital is coming soon. It'll be a 24/7 emergency department to start. Now I'll tell you more about that with this rural emergency health model. This new model that's been made available by the Centers for Medicare at the federal level, and then that the state of Iowa adopted in March of 2023. It's a new type of hospital, a new type of hospital license called a rural emergency hospital. And the notion is that you offer a 24/7 fully staffed emergency department with laboratory and imaging and pharmacy services, but you don't offer inpatient or ICU type services. So you provide the emergency department, and then in the event that someone is going to need longer term care, then that patient would be transferred through an agreement to an existing hospital in the region. But it provides a point of access for people that's closer than having to make that drive to another location. So those are the regulations that we're following. I won't go through this entire timeline, but I wanted you to see it, that we've been involved in this community now since January of 2023 with our letter of intent, with transferring through board substitution the assets of the hospital to the board that was affiliated with Insight. Last year, we worked with Carl A. Nelson on a preliminary assessment of the property. We identified, approximately $2 million in capital needs at a general level. I wanted you to know that we're very committed to this project. Over the course of 2023, we spent about $825,000 on the project to pay all the utility bills, keep the director of facilities employed, pay for all the insurances, have Carl A. Nelson perform the preliminary assessment. So we're very committed to this project moving forward. We, of course, are looking and we're asking for different forms of government support, but we're not waiting on that money to move the project forward. And our commitment is to get open as soon as we can. Our target has been to be open by the end of 2024. We're working on the design work this summer. Then we'll move to construction and staffing in the fall. I can tell you that we're honestly having some back and forth right now with the state officials, the state fire marshal's office, about what exactly we'll have to do to be able to meet the required codes and reopen the hospital. And depending on what we hear, that could change the timeline. We just want to be open and honest about that. So if you have some particular questions, Dan may be able to answer those better than I could. But we have a very clear on a 6-month plan in mind, but we're going to need some final guidance from the state on what will be required with the building. I know you all understand because you're dealing with a lot of these similar kinds of issues. We'll be the first rural emergency hospital in Iowa. The state just adopted the final rules 6 or 8 weeks ago. So everyone is kind of figuring out what exactly it's going to take in order to open under this new license. And we're not afraid of that challenge. We wanted to be the first in Iowa. We wanted to be part of providing a real solution to this community so that we're not only providing great medical care, but you also don't have the kind of transitions in terms of ownership and financial stress and all of that came with the prior kind of efforts to keep the hospital open. Because you might be asking, okay, well, what really changes in the model? When you receive a rural emergency hospital license, you also receive from Medicare a monthly facility revenue of approximately $275,000 to keep the doors open. So you don't have revenue from patients staying multiple days, but you get a fixed facility revenue to offset some of those basic costs for, utilities and security and those ongoing costs that you always have in a hospital. So this is a new model across the country. There's about 20 that have been licensed in various states. And that's the model that we think will be sustainable for this community. If you're familiar with the hospital, I know many of you probably are, we want you to know what part of the hospital we'll be utilizing for the rural emergency hospital, emergency department, laboratory, imaging, and pharmacy services. So we'll utilize the ground floor emergency entrance that's on Morgan Street, what you would think of as the emergency department. So that's where patients would continue to come in. We'll have the emergency department, the lab, the radiology, and pharmacy services. On your diagram, that's the blue, the yellow, and the green. The pink area would be brought up to code for purposes of licensing, but we wouldn't be utilizing it immediately for additional medical services. As we bring in other funding, as we hear more from the community about the kind of outpatient services that we could provide, those would go in the pink area, the former kind of surgery suite that was part of the hospital's most recent update. The facility is actually in pretty good shape, but there'll be changes and investments that we'll make to be able to provide those different specific medical services. So those color-coded areas would be part of what would be licensed from a building perspective, but the pink represents kind of phase 2 of the medical service utilization. It will continue to be a nonprofit hospital, so we will be marketing it as the Insight Keokuk Area Hospital. We really wanted to go back to the heritage of how the hospital was known for many decades. Want to focus on patient care, the financial stability that I've described. We also want to be more involved with partnerships in the community, like we're demonstrating this week with the Sylvester Broom Empowerment Village. We know we need to provide an emergency department, but the health of a community involves a lot more than, when you see a doctor, when you go to the emergency department. We need to be thinking about education and the health and fitness of our youth and providing a variety of different wellness programs in the community. So we want to be very proactive about that so that we can, hopefully, as we get together, years from now, we can see that this community is becoming more healthy, right? That there are better health outcomes across this community's population. That's really what we want to aim to do. We know we need to meet people where they are, so we'll have a charity policy and financial assistance. We won't be turning people away based on their insurance. We'll provide service, as I said, to those on Medicare and Medicaid. We'll welcome that. That won't be something that'll be a problem for us. And then we want to work with you as we get up and running to conduct that local health needs assessment and really know beyond the emergency department what else can we provide right here locally that would be a benefit to the community. Hopefully that didn't take too long. Gave you a good update on kind of what we're doing, why we're doing it, and what we hope to accomplish in the next few months.
Any questions, anybody?
Are you guys still thinking about doing services that generate more revenue, like plastics? And I feel like that's what we talked about the last time we met, or maybe it was with Dr. Shao.
Yeah, because our network is both hospitals, but also specialty clinics, we do have a lot of different options that we can look at together. So we have been having those kinds of discussions, and with that surgery side of the footprint, it could be possible that there could be a specialty clinic, even a few times a month or one time a week. So we are looking for how we can use the physicians who are already in our network, and you'll have your full-time staff who are always here, but then supplement that with other services like what you're saying. Mm-hmm.
I also think it's important. I don't know if all of you have met them before, but it really stood out, your guys' patient care. It was so important that they are big into surveys and that you were treated great from the moment you walked in till the moment you left, no matter what your income level is, no matter what your insurance is. And you can really feel that when you meet all of the people there. I'm really excited for Keokuk.
Yeah, no, thank you. We focus on the question, and we have an independent company that does this patient follow-up for us, where we ask the question, would you refer your family member, to Insight? Because we feel like at the end of the day, that's really the best indicator of whether you had a positive experience as a patient, is whether you could see, your mother or father or uncle or cousin or someone, also being served by Insight. Okay. Well, thank you for the time.
Nothing else?
I know you've already conducted a lot of business tonight, and if you don't already have it, I'll make sure you have my card. You're welcome to certainly speak with me anytime or follow up, and we can have a lot more discussions about the work we're doing. So, okay. All right. You're welcome. Thank you, everyone.
Thanks, Dane.
All right.
So with that being said, it was a great presentation. Thanks, Dane. I'm glad that we could see it. And We talked about this last night. I encourage people that when they talk about the hospital to try to think about it and talk about it as a rural emergency hospital, because I think, there's a concept out there that they're going to open the whole building and everything. So I encourage you to say emergency hospital so they realize that. And if you have questions, to kind of push that it's going to be an emergency room. That's what we need right now, and that's where we're starting. So I encourage everybody to do that. And with that being said, I think it's time to go home.
I think with Dr. Shah, right? Yeah, okay, good. Well, thanks for being here tonight. Thank you. Well, let's do the same thing. So you also have mine.